Ever wondered how modern tonsil and adenoid surgery is done with minimal pain and bleeding? In this video, we will show you the cutting-edge technique of Coblation tonsillectomy, where precision meets innovation. Watch as we use a bloodless method to safely remove tonsils and adenoids, ensuring a smoother recovery for our patients. Get ready to see the surgery like never before, safe, efficient, and virtually bloodless. Hello everyone, I'm Mr. Gaurav Kumar. I'm an ENT consultant working in National Health Service in London and Essex. Today we are going to take you inside the operating room to show you how tonsillectomy is performed. Before we begin, let me tell you about the tool we are using. This is a Coblation device which uses radiofrequency energy combined with saline, that is water, to gently remove the tonsils while minimizing bleeding. It is highly effective and safe technique. As you can see, the patient is now under general anesthesia, ensuring they feel no pain during the surgery. The mouth is kept open using a mouth gag, giving us a clear view of tonsils at the back of the throat. We begin by carefully placing the Coblation wand against the tonsil tissue. The device works by dissolving the tissue at a very low temperature, which significantly reduces the amount of bleeding compared to the traditional methods. Notice how precisely we remove the tissue. Only the tonsil tissue is affected, preserving the surrounding areas, thus minimizing the complication. Once the tonsils are detached, we gently remove them. Coblation is unique technology, allows us to do this with minimal trauma to the area, promoting faster healing. After the tonsils are removed, we inspect the area for any bleeding. Coblation naturally cauterizes the tissue, so there is usually very little or no blood loss. We ensure everything looks good before moving to the other side. When considering a tonsillectomy for yourself or your child, it's important to be aware of what to expect. The adenotonsillectomy procedure can make a significant difference for children dealing with sleep apnea or recurrent tonsillitis. Large tonsils are major contributors to these conditions, and by removing them, you're not only addressing the immediate issue but also improving long-term health. The long-term benefits of this procedure are substantial, providing parents with reason to be hopeful and confident. Imagine your child waking up feeling refreshed after a good night's sleep and no longer having to cope with the pain and inconvenience of repeated throat infections. The benefits can be life-changing. Adenotonsillectomy is generally safe and effective procedure, but it does come with its own set of complications such as bleeding, infection, and delayed healing. However, many of these issues can be minimized and avoided with the right precautions, so it's crucial to follow your healthcare professional's advice after the procedure. The procedure is repeated in the same way on the other side, making sure the Coblation wand is not directed towards the muscle, which can cause post-operative pain. Bleeding is controlled by the bipolar in the wand. When the wand is directed towards the muscle to control the bleeding, we ensure it is not on the Coblation setting but on bipolar setting. The dissection is done meticulously right next the tonsil. It is important, as you can see, when I'm dissecting, I'm keeping the traction up on the tonsil tissue so that I can clearly see my dissection plane. When performing a coblation tonsillectomy, it is important to be cautious around the lower pole of the tonsil as it receives the blood supply for the tonsil. Care should be taken to avoid entering the base of the tongue and to be careful when dissecting the lower part of the tonsil. After the tonsils have been removed, the throat is inspected for any bleeding and hemostasis is achieved. The oral cavity is packed with gauze soaked in numbing medication to minimize postoperative pain. Once it is ensured that the tonsil fossa is dry, 2 red rubber catheters are used through both nostrils to address the adenoid. Important not to pull too much on the palate to avoid bruising. Careful inspection of the adenoid is done with a mirror. The coblation is used to melt away adenoid tissue and is important to let coblation vaporize the tissue rather than trying to scrape the surface. The coblation technique allows for vaporizing and coagulation simultaneously, which can minimize bleeding during this surgery. Adenoids are small glands located at the back of the nose, playing a crucial role in our immune system during early childhood. When it comes to removing them, the method used can make a significant difference in outcome and recovery. The coblation or cautery technique is a modern advanced approach that gently vaporizes the adenoid tissue, offering a safer alternative to an outdated curettage method. Curettage involves scraping the adenoids away from the back of the neck muscles, which can lead to damage and unnecessary complications. It is essential to discuss with your surgeon the specific technique they plan to use to ensure you are receiving the safest and the most effective care. Another crucial aspect of adenoidectomy is a 2-catheter technique, which retracts the soft palate to prevent excellent visualization of the adenoids. This approach helps prevent damage to the palate, the eustachian tube opening, and the turbinates, reducing the risk of complications. In the patients with cleft palate, special consideration are required during an adenoidectomy. The central fat pad at Passavant's ridge is carefully preserved to prevent the complication of velopharyngeal insufficiency, a condition where food or liquid can regurgitate into the nose. Always make sure to consult with your surgeon about these advanced techniques to ensure a safer and more effective procedure with minimized risk. The procedure is complete and our patient will now be taken to the recovery room. Most patients are able to go home the same day with a recovery period of about 10 days after coblation and 2 weeks after bipolar. Adenotonsillectomy has come a long way, and with advanced techniques like Coblation and suction diathermy, we are able to make the process as safe and as comfortable as possible for our patients. Thank you for joining us today to learn more about this surgery and how it is performed. If you have any questions and want to learn more, feel free to reach out to me. Take care and stay healthy.